right, Dan, thank you for that. Well, the state of Nevada just starting to immunize healthcare workers and the elderly living in nursing homes. The state lost 57 people to coronavirus on Wednesday, more than ever before. The governor tweeted, that's another 57 Nevadans who will be missed by loved ones this holiday season. Well, the state is still seeing the fallout from the Thanksgiving-induced surge. Restrictions have been extended there until January the 15th. Well, joining me now is someone who is in the thick of the vaccine rollout. Dr. Bayo Curry-Winchell's own hospital in Reno, Nevada is at capacity, and she currently runs urgent care for the entire hospital system. We applaud you for your work. Thank you. You are really in the thick of things, running urgent care for the entire system in Reno. You describe your job in a few words. How have things been for you over the past few weeks?
First and foremost, I just want to say thank you for having me. For the past few weeks, we have been really, as a whole system, trying to provide the best care, which we are, under very tight strains as far as, capacity in our hospitals as well as in our urgent cares as well. So as a physician, I'm doing my best to, provide the best quality care, but of course with the increase in patient volumes that we're seeing, as well as the increase in acuity due to patients not wanting to go to the hospital, it's really been a new dynamic.
Yeah, and explain that to me, because I know that you've seen an increase in severe cases of COVID because patients have been delaying their care in fear of going to the hospital. Just explain further, if you will.
Great question. So what's happening, unfortunately, when patients are having difficulty breathing, extreme fatigue, they're electing not to come and seek care right away just because they're afraid, first and foremost, will I get COVID at the emergency room or in the hospital? Another big concern is, if I'm admitted, will I be able to have my loved one visit me? And unfortunately, another major concern is, will I be able to walk out of the hospital? So there's several things that are involved with the fear and delay of care.
CNN's US-based reporters have been covering the pandemic tirelessly, as have our international colleagues. Look, this isn't just a US story, of course. This is a global story, and governments around the world face real dilemmas. One of our US-based reporters, though, Sarah Seidner, did just visit a hospital in Reno that created a COVID-19 unit in a parking garage. I just want our viewers to have a listen to this.
It was scary. We don't expect to go to work and be working out of a parking garage. We've made it a hospital, so we don't even consider it a garage anymore.
Did you ever think that in America they would have to treat people in a parking lot?
I apologize for what I'm going to say. When they started building this, I laughed.
Look, remarkably, that unit is absolutely functional. It is safe and sanitary for patients. But I put to you what Sarah put to a couple of people in that report. Did you ever believe that you would see units like that in a parking lot in Reno?
I never thought I would see something of the sort. The only thing I can say on a positive note, I am so proud of my community that they have responded, appropriately and adequately and especially efficiently to provide care to our community.
How difficult is that? We've seen sort of similar setups in other places. I think, a parking lot used in Israel, for example. And then, the Nightingale Hospital in the UK set up in an events environment. Just for our viewers' sake, it seems almost inconceivable that these units would be fully functioning. How tough is that for you, your colleagues, to ensure that those places are adequate for the sort of patients that they will see?
It's extremely tough, but again, the system responded and we were able to implement all of the things that we do inside the hospital in a different way. And we are making patients comfortable. We're providing amazing care, but just in a different format. But it is difficult.
Not one that you would, not one that you would want to make a sort of regular care environment. I'm sure. Look, I know that vaccinations started yesterday afternoon in Reno. Many medical workers saying they had tears in their eyes once the vaccines arrived. And I know that you're scheduled to receive your first dose tomorrow. How are you feeling at this point?
I am elated to receive the vaccination. I feel that is going to be the start of a new era as far as ending the pandemic. So I am excited to receive it tomorrow afternoon. And my colleagues who have started to receive it as early as yesterday, they are just very grateful. I can tell you, we are grateful to the scientists to just take the time to produce something in such a quick manner so we can end this pandemic.
We are hearing reports of some people developing allergic reactions, or at least one in the US and I think one in the UK from this vaccine. Should we be alarmed? You're a clinician. What would doctors or nurses do to help a patient who is having an allergic reaction to this vaccine, and how common should we expect that to be?
So we have set up, and this is happening across the nation, when you receive that vaccination, we have you wait a time period between 15 and 30 minutes to ensure if, unfortunately, if you do have a reaction, an anaphylactic reaction, we are able to respond to it. And so those are the things that we have in place to make sure that every patient that receives the vaccination and may have a reaction, we can respond accordingly.
I'm just wondering, are you seeing any post-COVID complications in the urgent care that you're involved with that have or will affect people's long-term sort of prospects, or indeed their ability to return to work?
I am, Becky. Thank you for asking that question. We are seeing complications such as chronic coughs, shortness of breath, extreme fatigue, as well as loss of taste and smell. And it's important to mention this because it affects your ability to return to work as well as your daily activities. And when you talk about taste and smell, that is an important pleasure in life. And so when that has been taken away, that can really, have an impact on your everyday life. And these are the things we're seeing in the urgent care.
Dr. Bayo Curry-Winchell, you are seeing the upshot of people being determined to get together for Thanksgiving. And I know that you believe that you have cases as a result of those who got together and perhaps didn't socially distance over Thanksgiving. What is your message to those who may be watching in the US and indeed to our viewers around the world as we approach another holiday season?
My message is to really take in the guidelines of social distancing, have small groups, and wearing a mask. That is so important to help us, return to normalcy. And so, although it's hard not to be together during these holidays, it's very important to just continue safety measures that we have in place. And yes, we are currently responding to the Thanksgiving surge. And so our concerns as a medical community, what will happen, for Christmas if people gather. So it is a concern for all of us in the community.
Finally, how is your medical community coping? Because this has been an extraordinarily long year for what we will call our global healthcare heroes.
We are working together. I can say the collaboration and just the inner strength that the medical community has been extremely powerful. We are tired. We, carry with us every day the concern, I hope I don't bring this home to my family. But we are resilient and we continue to work together to provide great care because that's what we're in it for. I know as a physician, I love helping people. It brings me so much joy.
And you are a human being, and I know you've got 2 little ones at home as well, so understandably you face the same concerns as everybody else faces. But thank you. From Reno, Nevada, today, your insight and analysis, extremely important. Thank you. So look,
Thank you for having me.
Another, thank you, COVID-19 vaccine in the States, and that is great news for frontline heroes like Dr. Bayo Curry-Winchell there. We have got to protect them.